the relationships with our academic affiliations, whether it's for the medical schools, nursing schools, and allied health across the board, are extremely important, and it's bidirectional. It brings to the VA an incredible talent pool, both in terms of the attendings who supervise trainees, and it provides the schools an incredible patient base for their trainees to get the education that they need. And the VA population, I think, is unique for a couple of reasons. One is they do have issues that you won't encounter anywhere else in your medical practice, and it's very foundational to a trainee's education at whatever level they are, whatever role they are, the ability to care for veterans. And the other thing, and I think, all of us come into healthcare because we're in love with the art of medicine, and those of us who have come into the VA are in love with taking care of veterans. And frankly, throughout my career, I've never met a group of patients that were more appreciative of what you do for them. And I think particularly as trainees, they really have more time to interact with the patients. They learn a lot from them. And they really get the sense of the worth of the work that they're doing. Both the schools and the VA share equally in the benefit. If it were a lopsided relationship, there would definitely be issues. The real challenge is it's very difficult to quantify what that benefit is. And so when you say, well, can you put a dollar value on it in terms of the government getting what it pays for versus the schools getting what they pay for, it's really hard to do. And I think that as really understanding the value to the veterans, the value to the American public in training a qualified workforce to take care of all of us, because at some point every one of us is going to need good doctors. It's just there, and it needs to be appreciated, and it needs to be fostered. But we both benefit. I don't think any one side gets more of it than the other. But without the relationship, we'd both suffer.